Alright, today we're going to go over modules 1 and 2 and herbal therapy. So, what is the first to pass effect? Initial metabolism in the liver of a drug absorbed from the GI tract before it reaches systemic circulation. However, you give it by IV, it completely bypasses the first pass effect. And, yeah. What is the blood-brain barrier? Tight junctions prevent meds from entering the brain unless they are lipid soluble or have a transport system to enter. What is absorption? The movement of a drug from its site of administration into the blood. However, if you give it via IV, absorption is bypassed because it goes straight into the blood. Alright, what are enteric coated tablets? These are made to dissolve in the small intestine and not in the stomach. What should you not do with enteric coated tablets? You don't want to crush, you don't want to chew, and you don't want to cut them or take on an empty stomach or your big L. What are sustained release tablets? You're going to take them and they're going to release a certain amount over an extended period of time. And then you don't want to crush, chew, or give a different form of the patient can't swallow. What is an agonist? So it's going to bind to a receptor and stimulate a response. It's such like an opioid. What is an example of an antagonist? So it binds to the receptor and inhibits or blocks the response, such as Narcan. What is a therapeutic response or index? So this tells you if the drug is safe. If it has a large therapeutic index, it is safe. But smaller it gets, the relatively unsafer it gets. What are the 3 types of drug names? Chemical, describe the chemistry. Generic, non-proprietary. And the brand name, proprietary or trade name. What is an adverse reaction? Annoying, unintended, or undesired effect that occurs at normal drug dosing. What is an allergic reaction? It's the patient's sensitivity to a med because of an immune response. Patient may or may not have been exposed. What is an anaphylactic reaction? A life-threatening response characterized by bronchospasm, laryngeal edema, and drop in the blood pressure. They have been exposed. What is toxicity? Adverse reaction caused by excessive dosing. What is an iatrogenic effect? When a drug causes symptoms of a medical condition. Tell me about teratogenic effects. When a med harms the fetus of a pregnant patient. What is a paradoxical effect? When a patient has the opposite response to a drug from what is expected. What is a side effect? It is an unavoided secondary drug effect produced at therapeutic dosages. These are predictable and dose-dependent. What is an idiosyncratic effect? Uncommon drug response resulting from a genetic predisposition. What is a carcinogenic effect? It can cause cancer. What is an additive effect? Two drugs have a combined effect. This may be positive or negative. What is a synergistic effect? Two drugs have more of an effect combined than they would if each were given on their own. What is an adverse effect? Annoying to potentially life-threatening effects of a drug that may occur in normal doses. What is an antagonistic effect? Two drugs combined decrease the effect of each other. What is pharmacodynamic tolerance? Results from adaptive changes in response to prolonged drug exposure, increasing the MEC of a drug. What is pharmacokinetic tolerance? Results from accelerated drug metabolism, does not affect the MEC. What does pharmacokinetics mean? What the drug does to the body and how it gets to the site of action. What is drug absorption? Drug enters the body and the blood. What is drug absorption affected by? Age, hydration, activity, and surgeries. What is drug distribution? Movement of drug in the body. What is drug distribution affected by? Blood-brain barrier, cardiac output, pregnancy, and protein-binding interactions. What is drug metabolism? How fast the body breaks down the drug. What is drug metabolism affected by? First pass effect. Age, liver disease, kidney failure, and nutrition. What is drug excretion? How the drug exits the body, such as the renal, GFR, urine, breast milk, sweat, tears, saliva, stool, and lungs. What does pharmacodynamics mean? What the drug does to the body and the nature and intensity of the response. What are the signs of liver toxicity? Jaundice and liver functions test. What are the assessments for kidney toxicity? Urinalysis and serum creatine levels. What are the assessments for QT and cardiac toxicity? Heart monitor. Do not use two QT drugs concurrently, okay? What does kidney disease do to drugs? Reduces drug excretion, allowing it to accumulate. Increases the drug's half-life. What does liver disease do to drugs? Decreases drug metabolism, so drugs accumulate. What is bioavailability? Amount of active drug that reaches the systemic circulation from its site of administration. What are the factors that influence bioavailability? Tablet disintegration time, enteric coated tablets, sustained release tablets, and this occurs primarily with oral drugs. What are ultra rapid metabolizers? Too rapid drug metabolism, no drug response at normal dosage. What are extensive metabolizers? Expected response to standard dose. What are intermediate metabolizers? May experience some or lesser degree of the consequences of poor metabolizers. What are poor metabolizers? Too slow or no drug absorption, too high drug levels at ordinary doses, increased risk for ADRs. All right, now we go on to herbal therapies. Tell me about herbal therapies. Herbs or other botanicals intended to promote health and relieve symptoms of disease can vary in potency and concentration of active ingredients, classified as food supplements rather than drugs by the FDA, and are often part of CAM. Why do people take herbal therapies? Perception that they are safer and healthier, sense of control, cultural influence, limited access to professional care or insurance, convenience, and recommended by family and friends. What should nurses know about herbal therapies? Commonly used, can be beneficial or harmful, can be marketed without any proof of safety or efficiency, and can interact with conventional drugs. What are 4 questions to ask pertaining to herbal therapies? Why is my client taking this? What is its mechanism of action? Could this action interfere with my client's other meds? Could this action interfere with my client's disease processes? All right, St. John's wort is used for what? Depression. What is the action of St. John's wort? Increases serotonin by blocking reuptake and activated CYP450 enzymes. What are the side effects of St. John's wort? Nausea, headache, dry mouth, and dizziness. What are the nursing considerations of St. John's wort? Serotonin Syndrome, insomnia, phototoxicity, drinking too much caffeine, and it interacts with many drugs. What are the side effects of serotonin syndrome? Agitation, restlessness, confusion, tachycardia, high blood pressure, dilated pupils, loss of muscle coordination or twitching, muscle rigidity, diaphoresis, diarrhea, headache, shivering, goosebumps can lead to shivering and high fever. What are the assessment findings that place the patient at high risk with taking St. John's wort? Signs and symptoms of serotonin syndrome by patient on multiple SSRIs or antidepressants. All right, what is saw palmetto used for? Used to relieve urinary symptoms associated with BPH. What is the mechanism of action of saw palmetto? It lowers testosterone, but it could affect the male fetus. What are the side effects of saw palmetto? Nausea and headache. What are the nursing considerations of saw palmetto? Not pregnant, no blood thinners. What are the high-risk findings that place the patient at risk when taking saw palmetto? Pregnancy. What is ginkgo used for? Dementia and PAD. What is the action of ginkgo? Alters actions of platelets and lowers clotting. What are the side effects of ginkgo? Headache and vertigo. What are the nursing considerations of ginkgo? Drugs that affect bleeding, epilepsy, or low seizure threshold and surgery. What are the high-risk findings? What are the findings that place a patient at high risk of taking ginkgo? Pregnancy, surgery, bleeding disorders. Tell me the 3 harmful herbs to avoid. Comfrey, kava, and ephedra. Tell me about comfrey. Used topically and orally for inflammatory disorders. However, topical use is safe, oral use is not because it can cause liver damage and can potentially cause cancer. Tell me about kava. Used to promote sleep, relieve anxiety, and relax muscles. Can cause severe liver damage, though. Valerian is a good alternative. Tell me about ephedra. Used to promote weight loss, elevates heart rate and blood pressure. High doses can cause stroke, MI, or death, and was banned in the U.S. in 2004.